Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Buspirone. Its brand name is Buspar. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it really helps me with the YouTube algorithm. So what will we cover in this presentation? First, we're going to talk about how Buspirone works. We're going to talk about indications or reasons we would prescribe this medication to patients. We'll discuss contraindications or reasons we could not prescribe this medication to patients. We'll discuss examples of dosing as well as side effects with percentages. So how does this medication work? Well, unfortunately, its mechanism of action is not completely understood. However, having said that, we do know that it has a high affinity for serotonin 5-HT1A receptors and moderate affinity for dopamine D2 receptors. We also know that it has no effect on GABA binding. So when would we see Buspirone be prescribed to patients? So we often see this medication prescribed to treat anxiety, and an off-label indication is seen in depression. Now, in terms of contraindications or reasons we could not prescribe Buspirone to a patient, the only contraindication in this case would be a hypersensitivity or allergy to Buspirone or any other component of the formulation. Now for some examples of dosing with Buspirone. So in anxiety, the initial dose would typically be 7.5 milligrams twice daily, with the option to increase the dose by 5 milligrams per day every 2 to 3 days as needed. The usual maintenance dose would be 20 to 30 milligrams per day given in divided doses. And the maximum dose would be 60 milligrams per day, again given in divided doses. In depression, we would see 5 milligrams given 3 times daily, and this may be increased by 5 or 10 milligrams per day every 2 to 3 days as needed. The usual maintenance dose, where efficacy is established, is about 40 milligrams per day. The maximum dose in this situation would be 90 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Buspirone, so I'll go over some of those here now. About 5% of patients may experience a feeling of nervousness, while 12% may experience dizziness. Headache comes in at a rate of 6%, and somnolence may occur in 10% of patients. Nausea may happen in 8% of individuals. Now, some more rare but serious side effects would be congestive heart failure, a heart attack or myocardial infarction, or a cerebrovascular accident. Each one of these serious side effects would happen less than 0.1% of the time. That's all we're going to talk about today with Buspirone or Buspar. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information to be valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.